Hello and welcome to VetSOAP, an educational podcast for veterinarians, veterinary technicians, and animal health members. We are going to help you uncover the people and techniques used by your colleagues to remove the challenges of managing your practice. Why, you may ask? Well, to help uncover more opportunities, spend more time on the things that you enjoy, and ultimately help you make the money that you deserve. This is a production of the Viticus Group and filmed here in Las Vegas, Nevada at our beautiful Oquendo campus. Our website is viticuspodcast.com, and an audio and video production version of this episode is available at all your favorite podcast and video distribution platforms. I am so excited to welcome Dr. Dennis McCurnin. Dr. McCurnin is a board-certified soft tissue surgeon. Well, he's a board-certified surgeon, and he's also been the hospital director at Louisiana State University. But more importantly, he has been with the Viticus Group in so many different fashions over the last 51 years. And he has been a two-time board president, but also is just a great mentor when it comes down to the technician initiatives, and he is just pioneered veterinary medicine. So we are so excited to have him here to kind of talk to us a little bit more, not just about the history of veterinary medicine, but just how we've kind of changed over the last 51 years in our profession. So thank you so much for being here.
Great. I'm glad to be here.
So, I mean, we're coming up on our 95th anniversary of our veterinary conference. And after 51 years, you came in 1972, you were mentioning, yes, as the first one. And back in those days, I mean, there was just not a lot of distribution of knowledge. Like, you didn't have the internet, you didn't have a lot of the things we had. So how important was it to have a veterinary conference that you could come to, and what was that like?
Well, it was great. The first one that I attended, as you said, was 1972, and I had been out of school about 5 or 6 years and had gone through a residency at that point and was in practice in Phoenix, Arizona. So I was close here, and I'd heard about Western Veterinary Conference, and there really wasn't, other than the state and the local meetings, there wasn't much else going on. AVMA, but that was a larger trip, a longer trip, more time away. So I thought I'd just drive up to Las Vegas from Phoenix, and I did, and I just couldn't believe it. The number of people that were here, and of course it was quite small in comparison now to what we have.
Sure.
But it was probably, I don't know, 1,200, 1,500 maybe total people were at the conference. And I just couldn't believe the quality speakers that were here and the educational opportunities that I was able to achieve. And it only took one time for me to come here, and I was hooked. I wanted to come back. I didn't want the session to end. And I remember driving back to Phoenix after the conference and just thinking about all the good new things that we'd been exposed to during the conference. So I was one and done. Mm-hmm. I really wanted to come back.
Well, and I mean, you were very instrumental at our second building, the Eastern Campus. But it's interesting that you say that, because we had this great veterinary conference, but then we said, you know what, we really needed some hands-on training. How did that come about?
Well, that came about, over the years. This organization started in 1928, and then we fast forward to 1963, and we moved from Utah to Nevada. And we start holding meetings here, and then we fast forward again to about 2003 when we opened this Oquendo Center. And what happened in those years were more and more small animal, fewer and fewer large animal, more scientific evidence and treatments and knowledge, more surgical techniques, more imaging came around, which you'd be interested in.
Right.
And it just grew. And I think that we all realized that we're going to need to try to keep up every single day just about, and it hasn't slowed down. And so we needed more hands-on. And you can't teach surgery, that's my area, you can't teach surgery by watching videos. I mean, it helps, but you really need to get your hands in there and work with cases. And so we were able to do some live animal surgery. We had just started to work on models back then, mm-hmm, and started using models, but it was the hands-on, I think, that really made this organization grow, and it was so important.
Sure. So what is your most memorable veterinary moment?
In my life?
Sure.
Probably the most shocking moment was when I decided to become a veterinarian. And I was 11 years old. I remember it like yesterday in my hometown in Iowa. And I had gone out on the farm with the veterinarian that lived across the street from me in my small town. And he had a sow that was trying to farrow. And he's having difficulty. And so he wanted to know if I would go out with him and maybe help pull these pigs. And then he wouldn't have to do a C-section. So that made sense. My arms were small back then when I was 11. So we went out to this farm, and I remember walking into the farrowing shed, and it was in the fall. That you could smell the fresh hay and straw in this farrowing shed, and I could hear the sows oinking and so on. There were several sows in there farrowing, and they had pigs. And then we finally got up to this one farrowing crate, and here was a sow, and she was straining, and no pigs. And so Dr. Seeley, who I was with, Dr. Seeley examined the sow and said, yeah, she's full of pigs. Let's give her a little oxytocin and see if we can't get things started, and then maybe you can help her. And so she started to grunt and try to expel some pigs. And about that time, he said, well, I think you can help her now. Get your hands all lubed up here and, see if you can't get your hand in the vaginal area there. And so I didn't know what I'm doing. And he said, don't worry about it. Just get down here and I'll help. Well, about 30 minutes later, we had 5 live pigs. And I got up off the floor there of the shed and brushed myself off with the straw and so on. And the farmer, Don Altman, was standing in front of me, and he had these bib overalls on, like all the farmers wear in Iowa. And they have these little pockets here in the center of their bib overall, and they carry their chew and their pocketbook in there. And so I knew when he started fumbling around up there, he wasn't getting the chew. He was going to pay me something, and which I didn't feel that I needed. And so Dr. Seeley was behind me, and he gave me $2. And I said, no, I can't take that $2. And we went back and forth a little bit. Finally, Dr. Seeley said, McCurnin, take the $2, put it in your pocket, and let's go home. I said, okay. So I put the money in my pocket and thanked Mr. Altman, and we went and got in the pickup and drove back into town, which is about 1.5 miles away. And I'm thinking, as we're driving along, gosh, was this fun? I really like this. And you can make money at it. And so that was my introduction to veterinary medicine. I was hooked immediately. I never wanted to do anything else. And Dr. Seeley and I, later in life, were in practice together in Phoenix. That's how I finally got out to Phoenix. He moved from Iowa down to Arizona, and I followed him after I got out of school down here to go into practice. So that's got to be the most memorable moment.
Well, and I think what I love about that is that it's the hands-on experience, right?
Hands-on.
At the end of the day, we learn so much in veterinary school, but when you get out, we always kind of think you have all this information, but you just don't know how to apply it. And so you got that mentorship and that hands-on right away. But, and that's what the Viticus Group is all about. So what is it that makes these educational offerings so memorable that we're trying to perform here?
Well, I think to start with, back in the 70s when I first started coming, I think to start with, it was the quality of the speakers. They were nationally and internationally known. And very few people that I listened to, I did not, I knew of them before we even had the first lecture, and I'd heard of them. People like Dr. Joe Bozrab, as an example. He was teaching at University of Missouri in their veterinary school, and Joe and I got together early on out here. I loved to listen to his presentations, and in about 1969, fast forward, 1979, Joe and I were asked if we would not organize the veterinary technician program here at WVC at that time. And yes, we thought that was great. So he and I did the majority of the lectures because we were real involved with technicians at that time. And we were able, after 4 years, to kind of develop this program. And that was my first introduction into the administrative part of WVC. And I wanted to do more then, and so then I ended up going more into the hands-on activity and understanding we needed to do more labs. And that's what then prompted me to get on the board. And at that time, we hadn't even bought this piece of property yet. I remember coming out here and looking at this blank piece of property here, had no buildings, nothing on it, and we wondered, should we take a risk and spend all this money, membership money actually, should we spend that money and buy this property? Well, we did, and we built a little building over here on the corner, which was just torn down this summer. I was sad about that. But anyway, we had no concept that we would fill this thing with the Oquendo Center and so on. And so we kept moving forward and wanting more hands-on, and that's when we decided we got to build a facility. You cannot do this stuff in a hotel.
Right.
They don't want you to do it there, and they don't have the facilities. So we built this Oquendo campus and opened it up in 2003.
Sure.
And that was monumental for the organization.
So what do you think was the biggest struggle that you've seen that basically veterinarians have had to overcome over the time that you've been part, both in academics, now that you're kind of in practice, but you've kind of been associated with this organization? You know, you have this great kind of perspective. What do you think that was one of the things that if you're sort of like, gosh, this is where veterinary medicine has really kind of been able to overcome some of these hurdles?
Well, I think that utilizing technology has been one of those areas. Who could have guessed, where we'd be in technology today, from marketing your practice on the internet all the way to having a home page and sending materials to clients and doing all that kind of communication. We never would have thought about that. But we have to be able to communicate about something, and what we're communicating about are all the great things that have been discovered in veterinary medicine over the years. One of the things that kind of blew me away a few years ago was when we decided that we would marry veterinary medicine with human medicine. And we would end up being one medicine, so to speak, which had been talked about at AVMA for years, but we were really not able to carry it off completely. Well, here at the Oquendo Center, we were. And when Viticus Group came about, we were able to put human medicine and veterinary medicine together. And one of the exciting things that I remember coming into one of the labs and seeing what was going on for one of the human labs. One, I couldn't believe the cadavers they were using. That was different than using dog cadavers. The other thing was they had this big computerized, motorized machine, the Da Vinci. Yep. And doing a surgery by robot, and it just blew my mind away. And we're just now getting started in that in veterinary medicine, but the expense of one of these units, and the time I was here, I think they had 3 of these units, and they're like $2 million a piece. Right. But they can do unbelievable things in humans as well as in animals. So I look forward to seeing how that develops.
Well, I agree. It's funny you mention that, because it is this struggle that there's so many different things that happen on the human health side that we don't even know about on the veterinary side. And I think that bridge is something that you can work through. It's been one of the exciting parts of being the chief medical officer here, is just seeing some of these innovations and saying, how can I apply that to the veterinary side? What surprises you most about the veterinary industry as it relates to patient care?
Oh, that's almost a trigger, Tony. The thing that has bothered me the most in the 50 years that I've been in veterinary medicine, well, probably a little more than that, but the last 50 years, is the lack of utilization of veterinary technicians. Mm-hmm. And I have a special place in my heart for technicians, and I tried to use them when I was in practice in Phoenix, again, like 50 years ago, and allowing them to make me more efficient, allowing them to make me a better practitioner. we always, in our practice, we always had several physical exams on most patients. One was done by the technician, and another one's going to be done by one or more veterinarians. And it was amazing how many times we could miss things, and who cares who finds it? Whether it's the technician that makes the find, or whether it's the veterinarian that makes the find, who cares? That we're in this together for the patient,
right.
And if we can do a better job. So I really hope that we can learn to utilize veterinary technicians more, and maybe at some later point we can talk more about technicians, because I've got a lot to say about technicians. But technicians should be doing everything except diagnosis, prescribing, doing surgery, and giving a prognosis. Those 4 things a veterinarian must do by law, by license. But the technician in most states can do virtually everything else. And if we did that, we would practice a higher quality of medicine, we would be more efficient, and we would be more profitable.
Sure. And I mean, I'd be remiss to not mention the fact that you wrote the book on technicians, and you have a great book out on that, and you do help teach the veterinary technicians at PEMA here in town.
It's amazing. Here I'm back 50, in this 50 years, I'm just as excited today about veterinary medicine as I was then. It's never gone away. And so I'm still teaching about half-time in 2 different institutions now for veterinary technicians.
So what do you think the biggest struggle is, or how can veterinarians actually try to use their technicians more? Where do you think the hesitation comes from? Where do you think that people could say, gosh, you're right, I should use my technicians more? How do they go about it?
Right. Well, the problem is that we are teaching veterinary students, future veterinarians, in teaching hospitals. And in teaching hospitals, we do hire credentialed veterinary technicians. But those credentialed veterinary technicians teach.
Right.
They do not assist or aid or improve the ability of the veterinarian to practice. So there's no role model.
Yeah.
So when the student graduates from veterinary school, they've not seen a role model of how technicians should be used. So when they get into practice and they need help holding an animal or positioning an animal for radiograph or something, who do they holler for? Another veterinarian, because that's what they've done all their life. They use their classmates to help hold and move animals around.
Sure.
So I think that it's going to have to occur at the veterinary school, where we're going to have to start using them as role models there, so that they learn how to use them properly. AAVMC, our group that organizes the veterinary schools, they are now for the first time ever talking about this. How could we make veterinary medicine more profitable? I mean, nobody even wants to use that word, but if we don't have profit, we don't stay in business.
Right.
And we have to have profit. And so if we could figure a way out to become more efficient and handle more cases and do a better job by the use of technicians, why would anybody be against that?
Right.
And so I think we need to get the word out, and I haven't given up, but I'm getting a little tired after 50 years of trying to convince people that that's what needs to be done.
Well, and honestly, that's one of the reasons why we started a podcast. We're going to help pick up that torch with Crystal as being part of the program director of veterinary initiatives. We're really trying to push that envelope of creating that veterinary team, right? And right. Basically trying to use these kind of times to be able to figure out a better way to use our technicians and to optimize, like you said, patient care, making sure that you have multiple rooms going, because there's only one of us, and we could have a lot more technicians that can help out, and they're wanting it, right, with the technician specialties and things like that. That's
one of the reasons that technicians leave their job.
Right.
They're not utilized.
Right.
That's, in fact, it's even more important than the pay. I mean, we need to pay them more for sure, but the number one reason they leave is because veterinarians don't utilize them.
Right.
And here they spend 2 years in school, and they pass the national board, and they get certified or credentialed in whatever credential it is in your state, and then they're not utilized. And I certainly understand why it would be very frustrating.
Well, as you said, there's so much more we can talk about on this discussion, and we're definitely going to follow up. One of the things that we're going to do is have another discussion with Dr. McCurnin that will talk about the use of technicians, how you can actually implement them in your practice, all the pitfalls, but also, as we talked about, how to be more efficient, because I mean, honestly, that's what we're all trying to work on. So I can't thank you enough for your time. It's been amazing. I mean, like you said, you stop by here all the time, but it is just great to not just see you in classes, but also all your support and mentorship, and so thank you so much.
It's my second home.
I know, right? Well, you can come by anytime. So as we always talk about at the end of the show is that if you have any questions, comments, or suggestions, please feel free to reach out to us at vetsoap@viticuspodcast.com. That's vetsoap@viticuspodcast.com. Our registration's open for annual conference, so hopefully you guys can join us February 19th through the 22nd, 2023. We would love to have you out to Las Vegas. We have so many courses offered. We have so many of the great international lectures that Dr. McCurnin was talking about that'll come through here. But until that time, I want to thank you so much for listening and watching, and we will look forward to seeing you on the next Vet Soap, brought to you by the Viticus Group.